I'm Fiona, and I'm going to tell you something which many of you already know, which is that being a new parent is really hard work. You're exhausted, you're grappling with sleepless nights, having to learn all sorts of new things that you've never done before. And if you're anything like my parents, then you're also doing this while a screaming baby will not leave you alone for 1 minute of the day. So we all know being a new parent is a very tough job. But of course, every new parent wants the very best for their baby. And part of that involves making the most of the health services that you're entitled to, so your baby gets the checkups that they need and the life-saving vaccines that will help to keep them happy and healthy. But that's not always easy. Every year in India, 10 million children reach their first birthday without having received their basic recommended vaccinations. This means that in India, 1 child dies every 4 minutes from a vaccine-preventable disease. So just to reiterate, that's 1 child who will be lost in the next few minutes that I'll spend speaking to you this evening. Our mission at Suvita is to change this. The Indian government has made huge investments over recent decades to strengthen last-mile immunization infrastructure and ensure that vaccines are available for every child. India is one of the world's leading producers of vaccines, and it's actually estimated that roughly 2/3 of the world's children have at some point in their life received a vaccine that was produced by the Serum Institute of India. So the vaccine supply is definitely there, but communication with parents is the key remaining barrier. Many families who miss out on key vaccinations do so because they haven't got the necessary information about when and where to attend for an appointment, or they might not know that they're entitled to the service. So at Suvita, we run 2 programs to bridge this communication gap. First, we're building a growing network of immunization ambassadors. We do this by asking community members to nominate people who are well known within their community and who will tend to spread information about things like community events which might be happening. We then invite these influencers to become volunteer immunization ambassadors. We share useful information with them about vaccines through text messages and phone calls, and they then spread this within their own community however they choose. So, for example, they might bring it up at a village meeting, they might mention it to their friends at a women's self-help group, or they might simply pass it on directly to parents of young children who they know. So to give you a flavor of this, I'll share a quote from Brajesh, who's an immunization ambassador in Saran district in Bihar. He says, "Since I've been involved in this organization, I'm feeling good and I'm receiving an SMS regarding immunization. And there's clearly mentioned in the SMS, like when a child should get vaccinated. Also, whoever's eligible for the vaccination, I make them understand about the polio vaccination and ask them to vaccinate their child. And whoever's not able to go, then I take them there." So Brajesh is a really amazing example of someone who's embracing the role of immunization ambassador and playing a prominent role in his community to build people's knowledge and confidence around immunization. The other program that we run alongside this is sending text message reminders to new parents. So these messages are personalized with their child's name, delivered in the local language, and they remind the family of every vaccine that their baby is due along the whole immunization schedule. So we send a message 7 days and 1 day before they're due for an immunization, so that these are timed specifically to arrive when they're most useful, so that they can help a family first plan for and then to follow through on their immunization appointment. So why do we run these 2 programs specifically? Well, first, it's clear that they complement each other really well to deliver impact. Ambassadors can play a great role to build knowledge and confidence around immunizations in their community, so that parents know what they're entitled to and how to make the most of it. And then SMS reminders help families to keep on track by reminding them exactly when they can get to an appointment. Secondly, these programs serve really well to support and complement government-run services. We work closely with our government partners in Maharashtra and Bihar states to make sure that our programs are meeting their needs and really helping to connect people to their government services in the most useful way, plugging the information gap which they think are of greatest concern. And thirdly, there's really great evidence that this model works. So our programs were designed very deliberately based on a large study conducted in Haryana in India by Nobel Prize winners Abhijit Banerjee, Esther Duflo, and their colleagues. They tested a range of ideas to see what would most increase people's access to and uptake of immunization. And they found that this particular combination of SMS reminders and immunization ambassadors was the most cost-effective combination out of 75 different possible combinations that they studied. So it's a no-brainer. We're working to scale these programs across India. We're currently building a network of immunization ambassadors across Saran district in Bihar, and we're scaling SMS reminders in both Bihar and Maharashtra. But you've heard enough from me, so now I want to introduce you to Deepa, Avinash, and Gayatri, who are all enrolled for our SMS reminders in Bihar. Unfortunately, because of the technology, we can't show a video of them speaking to you themselves, so I'll pass on what they'd like to tell you. Deepa says, "The messages benefit us by providing timely reminders, which, in combination with the Ashes reminders, allow us to get our children vaccinated on time. Avinash tells us the messages are of great benefit as they alert us to the exact date the vaccinations are due for our children. And Gayatri says, my husband receives messages that tell us to get our children vaccinated, which enable us to get the vaccinations in time when we otherwise wouldn't remember the date. So if I didn't convince you before, then hopefully these guys have. We know that these programs are highly impactful. They help families and communities to make the most of the immunization services that they're entitled to. By scaling them across Bihar, Maharashtra, and beyond, we at Suvita are working to safeguard a happy and healthy future for India's children. Thank you.